This video is about the Trikwan Eye Cocktail. Now, having been published in medical journals about how to treat the under eye region globally, this is now what we think is the ultimate treatment for the under eye region. Now, who is this for?
If I could pick one patient in my clinic that best reflects all of my patients, it would be someone who's going to be between the age of 30 and 50, haven't really had a treatment before and feel like they look tired and don't know what to do.
Now, this isn't for people who have got deep hollows under their eyes. I mean, it is, but it's not really going to target the root of the problem. That's a separate treatment. That's more, you have to be assessed for maybe a tear trough filler, for example. But this is for people who want to really improve the skin quality around their eyes. Now, whether that's for crepey skin, fine lines, pigmentation, it's for a lot of things. But generally, people that don't want to do fillers in the area or a lot of Botox in the area.
So to summarize, fine lines, elasticity, hydration, dark circles, overall skin quality.
So now when you go on Google and you type in, what would be a good injectable treatment for my under eyes? What are the best treatments for my under eyes? You will get bombarded by an absolute minefield of different treatments.
This magic cream that does everything.
Yeah, a magic cream that does everything, or polynucleotides, salmon sperm, and then you might just turn your computer off and never look at it again. But what we have done here is we have taken all of the evidence-based treatments and all of the treatments that we have had a lot of success with over the last sort of 10 years of doing, and we have put them together in an evidence-based and effective way to give you what we think is quite literally the ultimate treatment for your under eyes in terms of an injectable treatment.
And we published all about them in global medical journals.
Yes, okay, that's enough. What is in the eye cocktail? Now, in the eye cocktail are 5 main things.
Yeah. So number 1 is going to be a polynucleotide, and this is probably the king of under eye treatments right now. But what's in the polynucleotide?
I mean, it's not salmon sperm for sure. Everyone might think it's salmon sperm, but it's not actually salmon sperm. That's just a bit of a buzzword for where it comes from. But they're essentially ultra purified, fractionated bits of DNA suspended in a gel. Essentially, that is talking to your skin, DNA to DNA, and it's causing regenerative change.
So it's going to improve fine lines, elasticity, hydration, but most importantly, it's going to undo damage under the eye. When we get pigmentation under the eye, some of the time that's caused by damage, so it's going to brighten.
And that is done by your own body doing it. So the polynucleotides are speaking to your DNA and telling it to wake up, start working. It's almost like a personal trainer for the cells under there. And we all know that the skin under the eye is particularly more sensitive. It's a bit thinner than the rest of the face and the body. So it needs a bit more particular care. So polynucleotides are an ideal ingredient to have in any injectable treatment done around the eye area.
Important point, not all polynucleotides are the same.
Nope.
We use Dermafocus Planest, and that's the one that we've had the most success with. It's also the best evidence-based one. Well, it won the Injectable Product of the Year at the Aesthetic Awards, which is basically the BAFTA Awards for aesthetics last year.
Well, the Oscars, really.
Yeah, all the Oscars, yeah. So we've already got a great option, but how do we make this option even better?
Next, we're going to put in something called NCTF. Now, NCTF is a cocktail of almost 60 different ingredients, and it has a decade's worth of robust scientific data. Now, if you watch enough of our videos, you know how much we harp on about scientific data, but this has pretty much the daddy of all data when it comes to science. It has randomized control trials, it has case control studies, and this has been done over a decade. So NCTF contains things like amino acids, peptides, vitamins like glutathione, which really brighten up the skin, and it is combined with 58 other amazing ingredients, including things like nucleotides, which are a type of polynucleotide, helping from a DNA perspective. But it also has things like vitamin C, E, all the different vitamins that you could want for your eye area, certain amino acids, which are the building blocks of all of the collagen, elastin, hyaluronic acid that's in your skin in that region, and countless amounts of other ingredients in there. So we combine that with the polynucleotides to turbocharge this cocktail.
And they compound.
Yes.
Because they're actually better than each one individually when combined. So it gets even better.
Yeah. Now, the third thing, this is not placed in everyone's cocktail. Similarly with when we do the face cocktail, the neck cocktail, we don't have to put this particular ingredient in everyone's cocktail, but it is really good for some people. Now, This is microtox or Botox, but this isn't Botox how you know it. It's not, putting it into around the area of your eye and freezing the muscles and you can't move. This isn't that. This is hyperdiluted, tiny, tiny, tiny concentrations of the Botox and injected in the skin only. So it's injected intradermally is what we would say.
So what this is going to do is it's going to target all the little fine lines and wrinkles just under the eye. So often we see people who are saying, can I please do something for these little ones just under the eye? Yes,
where your concealer just creases in, those ones.
And this is the best option for that. It's going to iron them all out.
Yes. Now, when we say it's not for everyone, if fine lines isn't your real concern and it's more pigmentation, then, we might not add the microtox. But this is a discussion that you would have with one of us in the clinic.
Next ingredient. Exosomes.
It's his favorite. He just loves exosomes.
With exosomes, these are going to be really, really important at helping regeneration within the area. They're going to take a bit more time to get working. So their time and placement in the cocktail is to apply now as a serum, but for it to have its maximum effect in about 12 weeks' time.
What are exosomes?
Exosomes are going to be little vesicles, which are little packets of information that contain different things in it. Messenger RNA, proteins, growth factors, all sorts of things that are going to help turbocharge the regenerative pathways and processes. Really, the thing it's going to help with is pigmentation and dramatically speeding up recovery, along with the regeneration of better quality tissue under the eye.
Now, the last and final part of the eye cocktail is the LED light. Now, after you've had your nice tiny, tiny little needles around the area with your NCTF polynucleotides and maybe or maybe not microtox, then we apply the exosome serums on top. Then once that has seeped in over about a couple of minutes, we take you down to have your LED light. So you have little goggles placed just over your eyes and you sit under the LED mask for about 30 minutes. Now, why is the LED mask so good?
Well, LED masks have been shown to work really synergistically with regenerative medicine treatments because it's giving your skin cells more energy. So that's the first point. The second point is it's going to dramatically speed up your healing processes and pathways. So the recovery from the treatment is going to be more like 2 to 3 days rather than kind of like 2 weeks. So what does the treatment itself actually involve?
So you'll come into clinic, you'll have a consultation with one of us, and then we will apply lots and lots of numbing cream to the region. That will stay on for anywhere between 10 to 20 to even 30 minutes. And then once that numbing cream is taken off, you barely feel the treatment around the eye, I must say. Most people find the eye area very, very bearable. We use the tiniest needles, and you'll see lots of tiny little blebs forming in the region.
They don't even bleed.
They don't even bleed yet, it's so tiny. And most commonly, within 24 to 48 hours, majority of those will go down.
People actually describe it as like a 1 out of 10 discomfort-wise, which is nice.
The bumps under the eye, they pretty much disappear 24 to 48 hours. Maximum, I would say 2 weeks, which is the longest we've seen it, but that is very, very rare. Majority of people, 2-3 days. So I wouldn't do this if you had an important event the next day or that evening, but give yourself a good weekend for sure.
So when would you notice the best result after the treatment?
So because this treatment has a regenerative element and an immediate element as well, you will see the best results 6 to 12 weeks after the second session.
So it gets better over time?
Yeah. So Dr. Sanjay, what is the aftercare for the Trikwan Eye Cocktail?
Well, it's really straightforward. It's just the simple things really. On the day, don't touch it, don't rub it, no makeup, no creams, because we don't want you to get an infection. The day after, we need to be a bit wary of temperature. So nothing too hot, nothing too cold. No saunas, steam rooms, jacuzzis, that type of thing.
So just another note on that is makeup-wise, generally you'll read online a few hours, but I would say when you get the eye cocktail done, try and leave it for a good 24 hours before you put any makeup on.
Just before we end, my favourite thing about this procedure. Whenever I like to think about procedure, I think about two things. What's the certainty of a good outcome? What's the risk of the treatment? With this particular procedure, the certainty of a good outcome is like 99%. So there are so many modalities that are amazing. It's going to be a high impact treatment and that's great. But best of all, the risk of the treatment is extremely low. What's the worst thing that could possibly happen?
Little bruise maybe?
Yeah, which will go.
Thanks for watching that video. I hope you found that useful. If you have any more questions, please drop them in the comments below. And we've got some more videos on the face cocktail and the neck cocktail, or videos about individual aspects of this cocktail if you would like to learn more.